1. Atopic dermatitis. Atopic dermatitis is the most common form of eczema. It usually starts in childhood, and often gets milder or goes away by adulthood. Atopic dermatitis is part of what healthcare professionals call the atopic triad. Triad means 3. The other 2 diseases in the triad are asthma and hay fever. Many people with atopic dermatitis have all 3 conditions. 2. Contact dermatitis. If you have red, irritated skin, thick scaly region that's caused by a reaction to substances you touch, you may have contact dermatitis. It comes in 2 types. Allergic contact dermatitis is an immune system reaction to an irritant, like latex or metal. Irritant contact dermatitis starts when a chemical or other substance irritates your skin. 3. Dihydrotic eczema. Seborrheic dermatitis causes scaly, oily patches of skin that produce dandruff-like flakes. These patches often appear where there are more sebaceous, oil-producing, glands on the body. This includes the hairline, scalp, upper back, nose, and groin. If this type of dermatitis develops in infants, it is commonly called cradle cap, and it does not reappear later. In teens and adults, however, seborrheic dermatitis will most likely be an ongoing skin issue. 5. Neurodermatitis. Neurodermatitis is similar to atopic dermatitis. It causes thick, scaly patches to appear on your skin. 6. Nummular eczema. This type of eczema causes round, coin-shaped spots to form on your skin. The word nummular means coin in Latin. Nummular eczema looks very different from other types of eczema, and it can itch a lot. 7. Stasis dermatitis. Stasis dermatitis happens when fluid leaks out of weakened veins into your skin. This fluid causes 1. Swelling. 2. Redness in lighter skin tones. 3. Brown, purple, gray or ashen color in darker skin tones. 4. Itching. 5. Pain. 8. Hand eczema. Eczema that only affects your hands is called hand eczema. You may get this type if you work a job, like hairdressing or cleaning, where you regularly use chemicals that irritate the skin. Causes. A common cause of dermatitis is contact with something that irritates your skin or triggers an allergic reaction, for example, poison ivy, perfume, lotion and jewelry containing nickel. Other causes of dermatitis include dry skin, a viral infection, bacteria, stress, genetic makeup and a problem with the immune system. Some environmental factors may also bring out the symptoms of eczema. These include 1. Irritants. These include soaps, detergents, shampoos, disinfectants, juices from fresh fruits, meats, and vegetables. 2. Allergens. Dust mites, pets, pollens, and mold can all lead to eczema. 2. This is known as allergic eczema. 3. Microbes. These include bacteria such as Staphylococcus aureus, viruses, and certain fungi. 4. Hot and cold temperatures. Very hot and very cold weather, high and low humidity, and perspiration from exercise can bring out eczema. 5. Foods. Dairy products, eggs, nuts and seeds, soy products, and wheat can cause eczema flares. 6. Stress. This is not a direct cause of eczema, but it can make the symptoms worse. 7. Hormones. Females may experience increased eczema symptoms when their hormone levels are changing, such as during pregnancy and at certain points in the menstrual cycle. Risk factors. Common risk factors for eczema include 1. Age. 1. Dermatitis can occur at any age, but atopic dermatitis, eczema, is more common in children than adults, and it usually begins in infancy. 2. Allergies and asthma. 2. People who have a personal or family history of eczema, allergies, hay fever or asthma are more likely to develop atopic dermatitis. 3. Occupation. 3. Jobs that put you in contact with certain metals, solvents or cleaning supplies increase your risk of contact dermatitis. 3. Being a healthcare worker is linked to hand eczema. 4. Health conditions. 4. Health conditions that put you at increased risk of seborrheic dermatitis include congestive heart failure, Parkinson's disease, and HIV/AIDS. Complications. Scratching. The itchy rash associated with dermatitis can cause open sores, which may become infected. These skin infections can spread and may very rarely become life-threatening. In people with brown and black skin, dermatitis might cause the affected area to darken or lighten, post-inflammatory hyperpigmentation or hypopigmentation. It might take months or years to return to your usual skin color. Symptoms. 1. Rashes that are scalier than those occurring in children. 2. Rashes that commonly appear in the creases of the elbows or knees or the nape of the neck. 3. Rashes that cover much of the body. 4. Very dry skin on the affected areas. 5. Rashes that are permanently itchy. 6. Skin infections. Adults who developed atopic dermatitis as children but no longer experience the condition may still have dry or easily irritated skin, hand eczema, and eczema on the eyelids. The appearance of skin affected by atopic dermatitis will depend on how much a person scratches and whether the skin is infected. Scratching and rubbing can further irritate the skin, increase inflammation, and make the itching worse. Prevention. Wear protective clothing if you are doing a task that involves irritants or caustic chemicals. Avoid dry skin by adopting these habits when bathing. 1. Take shorter baths and showers. 1. Limit your baths and showers to 5 to 10 minutes. 1. Use warm, rather than hot, water. 1. Bath oil also may be helpful. 2. Use a gentle, non-soap cleanser. 2. Choose unscented non-soap cleansers. 2. Some soaps can dry your skin. 3. Dry yourself gently. 3. After bathing, gently pat your skin dry with a soft towel. 4. Moisturize your skin. 4. While your skin is still damp, seal in moisture with an oil, cream or lotion. 4. Try different products to find one that works for you. 4. Ideally, the best one for you will be safe, effective, affordable and unscented. 4. 2 small studies showed that applying a protective moisturizer to the skin of infants at high risk of atopic dermatitis reduced the incidence of the condition by up to 50%. Summary. Eczema is a common inflammatory skin condition. The most common type is called atopic dermatitis. Eczema is most common in children, but the majority of children will grow out of it by the time they reach adolescence. Eczema can cause discomfort and can vary in severity. It can present differently depending on a person's age. In people with darker skin tones, the symptoms may be harder to see. Although there is currently no cure, people can treat and prevent eczema flares using home remedies, moisturizers, medications, and lifestyle changes.